Good morning, everyone, and a happy and healthy and much better new year. Out with 2020 and in with a prosperous 2021. I want to thank, obviously, our lovely sign language young ladies here. Thank you very, very much for being here to get the word out to those individuals in need. I also want to thank Dr. Kerouac, the President and CEO of Bay State Health Systems, and Dr. Robert Roos, the Chief Medical Officer, Mercy Hospital Trinity Healthcare, for always being here. Your partnership and friendship has been invaluable throughout this COVID-19 challenge we face that we'll continue to conquer. Same with Patrick Leonardo of AMR, Director of Operations. It's been invaluable, and I'm very thankful for all your efforts, as I am with all my cabinet heads down the rank and file, again, that have been tested and true through a number of natural and man-made disasters, and are hanging in there day in and day out as this challenge continues to spike. I'd also like to, I know she'll get mad, but wish my daughter Kiara, she just had her 21st birthday, so happy and healthy birthday, Kiara. Total confirmed COVID-19 cases, we are now up to 11,496 since this ordeal has started. The week number might seem low, 910, but that's because there was no testing going on with the holiday week with AMR. The monthly total was 4,496 testing positive with COVID. We continue to track, unfortunately, deaths that have occurred that are COVID related to Springfield residents. I'm sorry to state that we've had 8 more. Commissioner Carlton Harris indicates to me this is only up to December 22nd. We both hope we're wrong, but this number can obviously increase. So there was 8 new. Total deaths now, 158 Springfield residents have lost their lives from COVID-19. And again, our thoughts and prayers and sympathy and encouragement go out to all the affected families of the lost, who have lost loved ones. The breakdown is 67 white, which is 42.4%, 35 black, which is 22.1%, 52 now Hispanic, which is 32.9%, Asian is 4, which is 2.5%. The long-term care facilities encompass 58 deaths, so you could see that has stayed pretty stabilized and steady. The increase is coming residential. We are now up to 100 deaths occurring residential. That's 63.7%, and long-term care facilities 36.7%. Our senior citizens, their home delivery of meals continues, and I'm again very appreciative of those continued efforts through Commissioner Helen Carlton Harris, Sandy Federico, Elder Affairs, and Pat Sullivan, and TJ Plant and Vanpool. Governor Baker stopped the spread. Testing in partnership with AMR continues. It's been extended. We're going to expand it now, and we are really coming. I just had my early morning meeting, cabinet heads meeting, and we're at a critical juncture right now. The testing, which Helen and I have pushed for right from the beginning, we're going to continue to push. We need more and more testing, but now the vaccine. We need the vaccine yesterday. You'll see in my reports when it comes to police and fire, especially police, it is affecting the departments. So we're at a critical juncture now, and I appreciate all the efforts, whether federal, state, local, here, hospital, that this coordinated approach needs to move forward as quickly as possible. We're hopeful that, and I'm sure you get an update from Commissioner Carlton Harris and Dr. Kerouac and Dr. Ruse, that some of these issues hopefully can be clarified as early as this week, if not by next week. Commissioner Carlton Harris, again, will speak about the VAX force that we put together. This is to lend credibility to taking the vaccine. And I want to commend Commissioner Carlton Harris. I want to thank all the members who agreed to serve on this committee, a diverse group, to get that word out to young and old that the vaccines will help keep you safe and sound. And it needs to be done. And as I've said before, conspiracy theories don't solve or conquer medical challenges. Vaccines do. So you can listen to the experts and Dr. Kerouac and Dr. Ruse and Commissioner Carlton Harris. Let me give you some brief updates. I want to commend Commissioner Calvi, and I want to commend Commissioner Clapprood and Fire and Police Department working with our federal and state partners on the quick actions in making an arrest and a Martin Luther King Presbyterian Church arson with that individual who is of Bulgarian descent, Dushko Volchek from Holton, Maine. He's had numerous run-ins with threats to officials and to individuals. There'll be more information to come on this, but to me this seems to be targeted, and I appreciate working with our federal and state officials. But when you look at his history, to me this seems to be targeted, and this individual needs to be put away for a long time. We've been working very closely with Reverend Dr. Avery. We spoke to her a number of times during the holiday week and weekend, and she appreciates that. I'd also like to thank the groups that have stepped up already. Our newly installed Catholic Diocese Bishop William Byrne, who stepped up to offer MLK space so they can continue their actions. Paul Bertern of DeMorrow Carpet and Flooring, which has offered to do flooring for them, and Peyton Schubrick of Six Bricks, who has also offered help. Subsequently, in speaking with Dr. Reverend Avey, the fund has been set up. I think that is now people are aware of that, and that's important to continue the heart and soul of Martin Luther King Church. And I see that other entities now, especially religious entities, are starting to rally to help out too. So you have that fund, and again, people have contacted me, so you feel free to contact Carolyn Jackson out of my office or Tom Ash, my Chief of Staff, and we'll make sure we'll facilitate that to Reverend Dr. Avery on that. We had a New Year's Eve, which the police department received well over 300 calls. Obviously, the state trooper that was shot. Thank God, and to one of our officers, the quick response there with the tourniquet stopped that from being a complete tragedy. The state trooper is doing okay, doing well. Arrested was Christopher Gardner. Lo and behold, I'm like a broken record. 30 arrests, firearm charges, and this guy's out partying, shooting at state troopers, shooting at our police officers. I want to commend the Springfield Police Department and state police, especially Springfield Police Department. They were fired upon. The restraint that they showed not to return fire should be commended. We used one of our canine officers to make the arrest, and I hope our some of our judges and court systems does the right thing with this individual. You could have had multiple tragedies occurring on Nursery Street that late evening. So again, arrest was made. On a good note, continued meetings of neighborhood councils. I met with the Indian Orchard Citizens Council. Zeta Govan, who's the president, and Paul Karen, who helps them out, the former rep there, with Pat Sullivan and Coach Ed Whitley, my community development division, through Tim Sheehan. The Blooms in the Orchard, which is fantastic. They do hundreds of hanging baskets, well taken care of in the Indian Orchard Quarter, Boston Road into the Orchard, and they look tremendous, and we're going to try to continue to work with them. I did have a conference call on East-West Rail with the Transportation Secretary, Stephanie Pollock, as that project continues to move forward. The Oasis Food Bank, John Foley, again, very appreciative, with Sedesco, partnering with other entities and city entities at Central High School. We continue to feed 3,500 families every week to keep them going. I'm very appreciative of Congressman Neal, Richie, Chairman Neal. I believe he'll be giving us another update. He's in Washington this week, next week, but he was instrumental in our request of putting language in legislation to extend the CARES Act money so we could be more strategic in spending that money going into the next fiscal year. Very appreciative of that. He also subsequently did that for the disaster recovery money. We have Tim Sheen and I and TJ Plant appreciate that. So thank you, Congressman Neal, for always delivering for us, and we look forward, my cabinet heads look forward to our next update on other recovery packages to come from the federal government. On another good note, dear family, friends, in the business that's been in the city of Springfield this year, we'll be celebrating 75 years in business, and we look forward to doing a little event with them. That's La Florentina Pastry Shop, famous from all over. Nobody makes a better rum cake or sweetel than La Florentina. Actually, everything too. I don't care where you are in the country. So to Leo and Anna Daniele, Auguri and tante grazie. Thank you for your continued belief and investment in the city of Springfield. But 75 years in business, the wonderful La Florentina pastry shop. Just a quick update, Commissioner Clapper, the police is getting hit hard. They're down 33 with COVID. That's why the testing and vaccine needs to be moved as soon as possible. We are getting some assistance from state police, but we've been informed state police has been hit hard also too. So we'll continue to work together, and I appreciate Commissioner Carlton Harris' efforts with the state DPH to get that facilitated. Fire is down 5, but they're actually out 11 testing and 1 dispatcher, so that tallies up to 17. Same thing, testing and vaccine shots. We're trying to move ASAP. Again, Commissioner Calvi, I commend you and your team. Great work you did on the Martin Luther King arson case there. The firefighter who was hurt Christmas Eve is back at Brigham and Women's with the hand burns, and I spoke to him last week and hopeful that he can make a full recovery. Superintendent Warwick indicates on the meals, and again, a great partnership with Sedesco. We continue to feed our students and families breakfast, lunch, dinner, and snack. We're well over the 5 million mark, 5,262,926 meals. Before the holiday week, the vacation week, 92,104 went out for the weekend. They continue to retrofit with Pat Sullivan all the buildings pertaining to ventilation. Again, we're looking at a March timeline to have that all done. Attendance is staying pretty well, 92.1%. We, on DESE, we have exceeded the learning time, which is good. Some other districts haven't. And Danny will probably give an update on winter sports, and they've worked very closely with Commissioner Carlton Harris and AD Dwayne Early and Assistant Superintendent Lydia Martinez. DPW COVID-19, Director Signoli is down 2. Christmas trees will start picking up tomorrow. They'll really go for a month. You'll have 2 shots to get your Christmas trees picked up. Obviously, those are done on recycling days. And Director Signoli indicates to me they are going to go a few more days to try to get everybody's yard waste that still might be out there on that. Thank you, Chris. I saw the trucks out yesterday and last night treating the streets, and we wasn't that bad of a storm on it, but to make sure that the streets were treated. So thank you on that. Finances for my CAFO TJ plant. Since the start of this ordeal, we're lost $7.3 million. FY21, we're down $2.4 million. Total spending, deficit and grants is $18.7 million. Of that, 7.5 is still deficit. But again, I'm going to do whatever we have to do to make sure our residents and business community have what they need, as we've done with other natural man-made disasters. TJ's been very, very good. And cabinet heads have been very, very good. We've been able to offset about $11.6 million on grants. And again, we're very, very appreciative of Congressman Neal's efforts getting that extension for us on the CARES Act and on the disaster recovery money. That allows us to be much more strategic as we work our way out of COVID-19. Pat Sullivan, Director of Facilities and Parks, indicates to me he's down 5 with COVID. His team has been fantastic, retrofitting the schools and our public buildings. They're currently doing all the I-Wave installations now, and he's working very closely with Commissioner Colton Harris on setting up vaccine sites ASAP. And the Sierra Arena, again, this is still closed for this time period. Governor Baker and 6 other governors, New England and Jersey Governor Murphy, also have kept their interstate hockey travel has been delayed, so that's not occurring either. Echo Dev, Chief Development Officer Tim Sheen, he's down 5 COVID-19 in his division. He'll give you some updates on the federal recovery packages, and also I think that we'll be getting some news from Governor Baker on state money for Echo Dev to help our restaurants and when it comes to physical plant type aspects or street aspects. And Timmy, they've started the technical assistance to help out with PPP applications, which we appreciate on that. The HR labor and law update was a status quo from Attorney Bill Mahoney and Solicitor Ed Pakula. And the last thing I'll say before I turn it over to our medical professionals, we still have that fund at Wayfinders. That money is going quickly. That's $2 million to help out residents with rents and mortgages and utilities. And we're using Wayfinders as our conduit. So please, if you're in need, reach out to Wayfinders to help you out to continue to keep you stabilized in your home. With that, and again, I'm deeply appreciative that both Dr. Kerouac and Dr. Roos are here. They will give their updates, their wisdom and advice, and when they are done, subsequently when they are done, so they get back to their needs at their respective medical institutions, we'll take questions and comments. And to the media, thank you very much, again, for being here, the TV, radio, and print. The partnership is important to get this information out. A lot of people watch this, and it reassures them. I hear that, especially coming from our medical officials. And we all hearken for the day that you don't have to see my face on a Monday morning for a COVID-19 update. With that, the President and CEO of Bay State Health Systems, Dr. Mark Kerouac. Thank you.
Well, good morning, everybody, and Happy New Year. Mr. Mayor, thank you as always for holding these events and for the cooperation of your whole team. The story with COVID is one of accelerating spread, as I'm sure you've all heard. We're now at over 85 million cases across the world, 1.8 million deaths. The U.S. has surpassed 20 million cases as a country, 350,000 deaths. Daily new cases are getting close to 300,000 a day, and so the pace of things has really started to pick up. We expect that this surge will continue to increase because of the holiday travel and gatherings. The effect of those has yet to be seen. Massachusetts now has over 380,000 cases and over 12,000 deaths. New case rates have also picked up to new highs at about 4,000 a day, with about 60 deaths a day on average. Both of those metrics are also on the increase, and we expect them to keep going up for the next few weeks or so. Hampden County, 27,000 cases. The rate of new cases places it number 5 among the counties in Massachusetts. The whole state is pretty much turned red. There are 351 towns and cities in Massachusetts. 188 of them are registered in the red zone. That's 53%. Hospitalizations across the state are at about 2,200, over 400 in the ICU. Hospitals in the east are exceeding 80% of their stated surge capacity, so they're getting pretty close to the ceiling of what they can deal with, and everybody's kind of worried about that. Bay State Health has been back up in its numbers as well. We had gotten as low as about 130 prior to Christmas. Today we're at 159 as a system, 131 folks at Bay State Medical Center in Springfield, 28 in our community hospitals, which are an important safety valve for us. 12 folks are in critical care. Our test positivity rate is 8.3%, which is just a point below the state's rate of 9.4%. Still something very, very high. Anything over 4 or 5 is considered dangerous. Since March of 2020, since the beginning of the pandemic, Bay State Health has tested 211,000 individuals for COVID-19. 77,000 of those tests, about 35%, were related to outreach activities, trying to help out in congregate living situations, shelters, public housing, other healthcare providers, skilled nursing facilities, etc. Among our own patients, there were 134,000 tests, and over 6,000 of those came back positive. Of those 6,000, 2,076 were hospitalized over the year, and 361 died. And we send out our condolences to all those families. We all fear that our worst month is still ahead of us, and it could well be this month that we're in right now. Vaccinations at our center are proceeding briskly and efficiently. A total of 9,700 of our 12,000 employees have been notified, as well as some of our independent providers. 5,800 have received their first dose of vaccine, 2,300 of the Pfizer, 3,500 of the Moderna. We are using all of the vaccine that's being provided to us and are getting it into arms at a fairly rapid rate. Our highest number of folks vaccinated in a given day was 760 a couple of weeks ago. About 20% of people being notified are declining, but 60% of those declinations are of the soft variety. In other words, wanting to wait and see what happened to friends or colleagues. There are quite a few sore arms. We have occasional flu-type symptoms that have led to a COVID test. About 120 people were sick enough among the 5,800 vaccinated to wonder if they had COVID. They got tested. In fact, 10 of them had it and are now on quarantine. There have been still just a handful of people with more serious allergic reactions, and they have responded to standard treatments. Noteworthy that the Oxford AstraZeneca vaccine has been approved in the United Kingdom and in India. We'll see what happens in the United States, but obviously the more vaccines that get approved, the faster we can go at vaccinating the general public. We do appear to be picking up speed. I know there's been a lot in the press about the shortfalls in the month of December. I think if we keep up our current pace or even pick up a bit, we may end up about 2 weeks behind schedule in terms of getting things done. And I honestly don't have any reason to suspect that we won't be able to complete things That is to say, in the month of January, that first group, in the month of February and into March, the second group of people at high risk and so-called essential workers, and then the general public in April and May. I'm appreciative to the frontline workers for their dedication and compassionate care that they showed throughout the holidays, and I thank all of you who kept your celebrations small this year. It is the best way to express how much you care about family and friends. For those of you who decided not to follow the guidance and elected either to travel or be with others outside your households, please realize that you have placed yourselves and those around you at increased risk. And for that reason, I would strongly urge you to lie low for 10 days after whatever exposure it was, whether it was a gathering or travel, and to get yourself tested if indeed you have the typical symptoms of COVID, fever, aches, cough, etc. I certainly hope that all of you who have done this get away with it, but I know that not all of you will. And so to the extent that you've taken the plunge, I'd urge you to try to minimize the risk of those around you by keeping quiet for those 10 days following the exposure. The other big news, of course, that you've heard is that the existence of a new variant of COVID-19, first isolated in the United Kingdom. It's been confirmed in 3 states in the United States. It should be assumed to be here in Massachusetts. The disease is no more serious than the prior strains of COVID-19 that were circulating, and the vaccine appears to be as effective. This is based on data coming from England. However, those who are infected, for some reason that we don't yet understand, appear to be more contagious. The same public health measures work, but they are therefore all the more important now to follow them. I'll reiterate that we are almost there with the vaccine. It's just a few short months away. Please try to observe the standard precautions of consistent masking, hand washing, social distancing, avoiding crowds, and don't put yourself or those you love through COVID. And hopefully we can get everybody to the point where they're vaccinated and we can say goodbye to this terrible disease. So, Mr. Mayor, thank you again for the opportunity, and I'll hand it over to Dr. Roos.
Thank you, Dr. Allen. Dr. Robert Roos, the Chief Medical Officer of Mercy Hospital, Trinity Healthcare.
Thank you, Mayor. And good morning, everyone. And I want to thank the media as well for continuing to report out on the pandemic. I hope you, Mayor, and your family and all the residents at home have had a safe and a healthy start to the new year. I think with each new year certainly comes moments where we think of opportunities for new hope and promise, and for many people this is a time to start fresh, to pull together, and to do things perhaps a little bit differently in the spirit of self-improvement. It can't be said enough that the last year, 2020, has been full of challenges, pain, and strife, and I know that many of us would like to put this in the rearview mirror, but it's going to be a year that many people will find it hard to forget. As Dr. Kerouac mentioned, when we look at the statistics, the reality is very, very grim. With the 85 million confirmed infections across the globe and the nearly 2 million deaths, with the 20 million confirmed infections here in the U.S. and over 350,000 deaths. Unfortunately, we just have not comprehensively contained this virus at all here in the U.S., despite being one of the world's most scientifically advanced countries. We continue to actually be worst, if you will, in the number of confirmed infections at quite a margin, with nearly 25% of all the world's infections to date, despite being just 4% of the world's population. 10 million more confirmed infections than the country that's reporting the second most, with India, and 14 million more infections than the country reporting the third most, Brazil. We also happen to have the 4th worst rate in terms of the numbers of deaths per 100,000 residents in a population, at over 1,000 deaths per 100,000, which means that during 2020, just under 1 out of every 990 Americans died of COVID. And the number of new cases per day during this third wave is not going down. In fact, it's threatening now to reach new heights. As on Saturday, there was almost 300,000 new cases reported, considering that there were some tests, though, in there from the holidays. In Massachusetts, the number of new infections has gone up and down a little bit, but remains at over 4,000 per day. The test positivity rate has continued to go up, and when taking out the infections from higher education has been over 9%. And of note, the tests that are done repeatedly on those associated with higher education is also starting to go up. From down at about 0.1% now, it's actually approaching 1% in total. The total number of hospitalizations continues to climb. It was just under 2,300 yesterday, and here in Massachusetts, with over 12,160 deaths to date, here in Massachusetts, we've actually lost 1 out of every 560 residents to COVID over the course of the past year. At Mercy Medical Center, we've also started to see the bump in hospitalized cases that are coming from the holidays as we expected, and we are bracing for more. After reaching our low in December of about 18, this morning we are back up to 29 hospitalized cases, although just 2 in our intensive care unit. We continue to also see high rates of community transmission, with our test positivity rate over the past week at 11%, performing just under 3,000 tests a week about. We are managing okay in terms of overall capacity, but it is tested at certain moments. We are managing okay in terms of testing and supplies and PPE, and we've kept all of our safety protocols in place and enforced. But my concern, as was mentioned, remains extremely high, that this surge of cases and hospitalizations could just get worse. There were reports that travel was at an all-time high since the beginning of the pandemic this past week, with about 1 million travelers checking in at airports each day. We know that the gatherings around the holidays will certainly result in clusters of new infections in many, many communities, if not all. And the new coronavirus variants that appear to be more infectious, as mentioned, have been found in at least 3 states and could be the dominant form here in the United States within a matter of months. And we know when we look at the number of new cases per residence in the UK and in South Africa, which has seen 2 variants that appear to be more infectious, the rate of increase is exponential. And so the priorities for 2021 for each of us remain very similar to what we've been talking about over the last 10 months. They are to stay safe, to remain vigilant, and for us to focus on becoming stronger as a community together. With safe and effective vaccines, we have a great reason to be hopeful. I believe that we can actually use this moment with all the pain that's been experienced, not to reinforce that trauma or to wither away from those challenges, but instead to grow from them and to build resilience. With my behavioral health hat on, I'll describe a term that helps articulate this phenomenon. It's called post-traumatic growth. It refers to a positive psychological change that comes from the result of a struggle with highly challenging life circumstances. And it's done by establishing a perspective of what a new normal is when the old normal is no longer an option. I think it's safe to say that we can all agree that the old normal, the one we knew in 2019, is gone. It's going to take many months for us still to figure out what the new normal in 2021 is going to be. But I believe that we can emerge from this stronger, as we've talked about, both personally and as a community and as organizations, by supporting efforts along the 5 domains of post-traumatic growth. That includes the development of more and deeper relationships, remaining open to possibilities, developing a greater sense of personal strength, a stronger sense of spirituality, and a greater appreciation for life. Now, when we look back at 2020, there's a lot of destruction and pain and tragedy, but I also think that there are elements and examples of this type of growth all around us. We have all created new relationships. At Mercy, we've created relationships with community partners like we never had. Legislators and elected officials who have since passed legislation recently that help support many of the efforts that we're striving for to combat COVID, like expanding telemedicine and coverage, elimination of surprise billing. We've established relationships with our regional hospital colleagues across state lines and here in our own community to be able to create a stronger network for healthcare in Western Massachusetts. We've created relationships with institutions of higher education, both for providing housing for our colleagues early in the pandemic, but also for testing and for protocols. We've created relationships with our supply chains and gotten innovative and deepened those relationships, as well as the connections that we've had with all of our first responders and our departments of public health. We've also remained open to new possibilities, virtually around every corner. We've created new ways of doing things, providing safe care to patients, protecting our colleagues, instituting telemedicine as an efficient and effective way to deliver care, learning and incorporating the latest testing methods and implementing the newest treatment guidelines, and now moving forward with a large-scale vaccination effort. Our colleagues on the front lines have demonstrated unbelievable personal strength, like they never knew existed, day after day, month after month, working together and supporting each other. And at Mercy, while our sense of spirituality and appreciation for life has always been a focus, I think this year brought it squarely into view with our resiliency rounds, our recharge rooms for colleagues, and our continued efforts to ground what we do in both purpose and meaning. And so as we all look to 2021, I encourage us not to just try to forget 2020, but to rather build upon it and improve and learn from it so that we don't repeat the events of our past in 2021. I think the COVID vaccine process is a perfect example of that and also a reason for hope. We already have 2 vaccines that are safe and effective, and likely there is a third on the way, having received authorization in the UK and India. We have the potential to deliver these safe and effective vaccines to hundreds of millions of people across the country, but we must also do it right. We must ensure that we have clarity and transparency, the supply that we need, and coordination of efforts to ensure that it's distributed equitably and fairly. There are conversations in many circles right now about how best to do that. And at this point, I believe that we should not, as has been suggested in other places, intermix the vaccines and use one brand for the first and one brand for the second. We should not be delaying second doses in order to expand the reach of first doses without more independent review or an assessment by the FDA. The EUA has clear parameters for both the Pfizer and the Moderna vaccine, and the FDA has the ability to review if there's going to be any changes to that before that we should move forward with that. And right now I know that they're doing that to review whether or not a lower dose of the Moderna vaccine would be just as effective and provide more supply going forward. And I believe we should wait until that review is completed before we make any changes. At Mercy, we're proud to have opened up our vaccine clinic for healthcare workers. It's going very well. We will have utilized all the vaccine that's been given to us by tomorrow. We've vaccinated over 1,200 colleagues who are providing direct and indirect care who are at risk of exposure to COVID thus far. We're interested and able to vaccinate thousands more people in our community who would be at risk. And we're just awaiting, at this point, further guidance and distribution from the Department of Public Health. As a vaccine recipient myself, in the chair of our distribution task force, I really could not be more proud of our team, more grateful and impressed by the feat of science that this vaccine represents, or more filled with promise for this year. Now, anyone out there who knows me personally knows that I'm not a fan of a long list of New Year's resolutions. I think we know that most people flame out and give those up after just a week or two. But instead, I try to use the opportunity of each new year to stop, take a breath, to focus internally on what matters and fortify the continued focus on self-improvement and learning. It's something that I have personally found to be very helpful in a mundane life, and one could argue that it's even more important amidst a pandemic. In fact, it's the countries that have been able to continually learn from the science, shift their strategies, and be resilient, to show post-traumatic growth that have proven to be the most successful in beating back this pandemic. And I believe that we can still do that. So please be well, stay safe, wear your masks, physical distance, and avoid gatherings, and be ready to sign up for the vaccine as soon as you're eligible. Thank you.
Thank you, Dr. Roos. Dr. Roos and Dr. Kerouac will take questions or comments that you might have from the media. I know Nick Oresco's here from 22 and Eric, Western Mass News, and Paul Pablo.
I'm curious, you had said that the state has been trying to distribute its patient load a little bit more evenly, to some of the community hospitals. How does that work exactly? Beforehand, were people just all getting funneled into Springfield unless they were really mild cases? Or, I mean, how is it that it's different now than it was before in terms of distribution? I mean, there were people at all three community hospitals before, too.
Right. There have been a couple of things that we've instituted. First, of course, people do show up in the emergency rooms of all of our community hospitals, and if they're adjudged to be relatively low risk and not likely to need critical care, they may be kept there. And so that is one thing that will ensure that there is, unfortunately, a steady supply of patients there. In addition, we've sometimes offered people the ability to be admitted to a hospital closer to their home if we judge them to be low risk at the Springfield campus, or if they're at the tail end of their illness and recovering, we may actually allow them to complete that recovery in a community hospital. So we're trying to load balance to a certain extent actively.
And do you have, I was looking at some of the numbers, especially after you mentioned today's figure was at the hospital, the cross hospital center. It's kind of been like a roller coaster for the last 2 weeks or so. There hasn't been a real change in terms of what they talk about plateauing at least until Christmas through most of December. So I'm just curious if there's any reason why you're suspecting that there was that kind of up and down, even though there didn't seem to be any changes in the cases coming in over the last 2 weeks.
Right. The curve has always been a jagged one because the number of people coming to the front door varies from day to day, and also how long they stay in the hospital and how quickly they're discharged will affect how many are still there. And so I don't make too much out of, switches from day to day. And it's really the dramatic increases that we worry about more, particularly in the next few weeks, because as we know, the first thing to happen is exposures, then it's test positivity, then it's people starting to feel sick enough possibly to be in the hospital, and a percentage of those who will go on to die. So we're still several weeks out. Some of those are still lagging indicators. The first thing that we worry about and we look for is increasing test positivity.
And one more question, and this goes to both of you, especially because Mercy is part of Trinity Health and have a lot of facilities in Connecticut. I'm curious if you have any opinion about how the way you described it is that we're not as stressed out as they are in Eastern Massachusetts generally, and I'm observing that there's been a cooling a little bit in Connecticut's numbers. I'm curious if there's any insight you may have. Maybe we're more just trailing them. Maybe they're doing something else that we need to be doing in terms of why they seem to be a little bit more stable, a little bit better off than Massachusetts has been.
I can just comment a little bit. So Dr. Kerouac and I were just commenting briefly before the conference this morning about the differences in ICU admissions and percentages in Western Mass versus Eastern Mass. And I don't think either one of us has the answer to that, but it certainly is something that has been observed and we're thinking about. And perhaps we've had lower numbers or percentages of COVID cases admitted to ICUs here locally than they have out east, which is partly why they may be experiencing the surge in a more profound or challenging way. In terms of the experience in Connecticut, I'll share Trinity Health in New England, of course, has acute care medical facilities in Waterbury, Connecticut, as well as Hartford, and then a facility in Stafford Springs, Connecticut. The hospital in Waterbury, Connecticut, which is closest to the New York line and furthest south, has experienced the most significant surge. And that has really been one of the leading indicators, if you will, for where we thought the surge would move. Because typically in the first surge of cases, we saw that hospital experiencing it first, and then it sort of traveled northbound up I-91 and went to Hartford and then up to Springfield. In this surge, it's been a bit different in that St. Mary's continues to be the hospital that is experiencing the most volume and the highest acuity relative to its size. It does not seem to have traveled as much north this time to Hartford or up to Springfield. And so there must be some other factors at play there. And so, we're continuing to monitor that on a daily basis. But clearly there are factors related to, travel, community resources, efforts at the local Department of Public Health level that may be impacting some of what we're seeing too.
Are you speaking to your colleagues in Connecticut, are you finding that the public policy or any other type of community level change is making for a slightly different circumstances in Connecticut? And again, it's not exactly a fair comparison because it does seem Western Mass is more in line with Connecticut than the state as a whole, but in terms of how they've been able to handle some of this process and some of this situation with therapists, it does seem like Connecticut's been holding out better now, certainly in comparison to spring, when it's one of the epicenters of the pandemic.
Yeah, I can't speak to any particular one policy. I think that largely the states have taken a very similar approach to having a tiered approach to restrictions, for example, in the community and that sort of thing. And there may be slight differences week by week about when certain things opened up or closed back and rolled back that could look at. One difference that I have noticed over the past month that I think will be interesting to see the effects of over time is the speed and the transparency of the vaccine rollout in Connecticut has been very quick. Very robust, with regularly scheduled dates and quantities of vaccine that are going out to hospitals, and a real encouragement to deliver vaccines to as many people as possible, including those outside of the four walls of the hospital. That has not been the experience thus far in Massachusetts, and it may be based on total supply that's available to the state. But I think that is one difference that I think is interesting and we'll maybe see some effects of in the future.
Getting back to the point you made earlier, Dr. Caroline, about the vaccine rollout timetable, obviously the mayor indicated he's anxious to have public safety first responders get the vaccine, which I believe is supposed to be happening sometime this month. So, Doctor, what makes you optimistic that it's going to stay, that you think it can stay on the schedule, so to speak, the phased rollout of the state is proposed?
Well, I think with any sort of a logistics problem of getting vaccine to hundreds of different locations, anybody who's worked in logistics knows that there's hundreds of ways to get it wrong and there's only one way to get it right. So your IT systems could be a problem, space could be a problem, personnel, refrigeration. You've got to get a number of things to go right. And so in the early phases of a complex logistical problem, you're going to see some stumbles, and the stumbles are going to be different in different locations, and it's looking as though people are learning from those things and getting past them, and it's kind of picking up speed. I would have been happier if we had hit the ground running 2 or 3 weeks ago, but that didn't happen. Now at this point, I'm most interested that we've learned and that we're getting better and getting faster, and it appears that we're getting faster at getting stuff into arms, which is really what the bottom line is. And it's based on that I say that I think we should be able to catch up and still hit those original timetables.
Any other questions or comments for Dr. Kerouac, Dr. Roos? Okay, gentlemen, thank you very, very much.
Take care, Mr. Mayor.
Stay healthy. Thank you again, Dr. Kerouac and Dr. Roos. The partnership's been invaluable. You and your family and staff stay healthy. We'll now get our public health perspective from the Commissioner of Health and Human Services, our Dr. Anthony Fauci, Helen Carlton Harris.
Thank you. Thank you, Mayor. Thank you, as always, for your amazing support. Happy New Year. And I guess some of us wonder, are we in a new year because we are carrying with us some of the same challenges that we had in 2020, but our hope is that 2021, as we move forward, is better for all of us, and we can get back to some semblance of normal. In the Commonwealth of Massachusetts, as of January 2nd, there were 987 cases as of January 2nd. That's 32,256 more than I reported last week. The deaths among confirmed cases, 12,263. That is 531 deaths just from 1 week ago. 105 of those deaths happened yesterday. Total cases in Hampden County, 26,886. That is 2,220 more cases than reported last week. And the total deaths in Hampden County, 1,055, which is 27 more deaths than we had last week. The city of Springfield is reporting 11,496 cases, which is an increase of 910 cases. And the mayor has talked to you about the deaths that we have experienced since I last reported, and that was 8. And as everyone has said, our condolences go out to those families. It is important to remind ourselves that these are not just numbers. We get so used to hearing the numbers that often we get numb. We get numb because we hear a number like 531 deaths, and we hear that number. There are 531 individuals in that number, families, a loss that's so profound that many individuals will never, ever, ever recover. And so we carry them with us in our prayers and in our concerns. And so we did experience 8 more deaths in the city of Springfield. When we look at the map, the number of cases from November was 2,667, and I'm at the line graph right now. And then in December, our cases are 4,496. In 1 month, we have had an increase of 1,829 cases in the city of Springfield. Obviously, this is the highest month that we have experienced ever, and I am so hopeful that this is the highest month that we will ever see. That 174 that you see, that is the beginning of January. And again, those numbers go through Saturday and do not include Sunday. In our zip codes, 01101, 01101 had 6 cases, 1%, 03, 5 cases, and 0%. 04, 171 cases, 19%. 05, 69 cases, 8%. 07, 78 cases, 9%. 08, 157 cases, 17%. 09, 179 cases, 20%. 01118, 87 cases, 9%. 01119, 64, 7%. 01128, 18, 2%. 01129, 36, 4%. 01151, 40, which is 4%. We continue to test, trace, and treat. Tracing, as you know, the contact tracing is done by the CTC, the collaborative at the state level, the Community Contact Tracing Collaborative. We are testing still. We want to again thank AMR for all that they have done as far as testing is concerned, and I will give you their numbers shortly. It is amazing the kind of numbers that they have done in comparison to others in the region who are doing testing. Community spread is real. It is still happening. We know that large gatherings and small gatherings, as we trace the cases in the city of Springfield, we are seeing numerous clusters in households, numerous clusters on streets and in neighborhoods. And so we know that there is still community spread there. We continue to ask you to be vigilant. We are starting to see the Christmas surge. I suspect this surge will continue. We ask, as we have when we appear, please know that this is a highly contagious virus, and we ask you to think about it in the harm reduction model. Those of us who worked with substance use disorders really understand harm reduction. It is that you may not think that this impacts you because you are not taking the precautions you should, but understand you want to reduce the harm you're doing to the community and to your families and to those around you. You reduce that harm by wearing a mask, washing your hands, watching your distance. Please think of it as a community harm reduction initiative. Reduce the harm in your environment. The vaccine rollout has begun. It is our anticipation that the Board of Health will receive vaccines sometime this week to be distributed to first responders. The state of Massachusetts is using what is called the pre-mod or prep-mod model. It is a website that will be published on mass.gov, and it will make sure that we are scheduling appointments, that we are tracking who we're giving the vaccine to. I know that it would appear that it's a process that perhaps should be one that would be a no-brainer, but it's not. There are forms that need to be filled out. There are input that needs to be done into the state website. There are questions that need to be asked. There are health screenings that need to happen prior to vaccination. We need to make sure that all individuals we are vaccinating are clinically eligible to get the vaccination, do not have pre-existing comorbidities that we should know about. Do we need to get a physician's order for this particular individual? And so we are in the process at this point is developing our operational protocols, some of which are already in place because we do already have a health center where we have policies and procedures around vaccine administration. We will follow those locally, and we will work with the Commonwealth of Massachusetts. There have been rollouts that have not been successful. We want to make sure in the city of Springfield that that rollout is as concrete, complete, and that we are doing all necessary to have an effective process, including making sure we're scheduling those individuals for 4 weeks later in order to get that second dose. I do agree with Dr. Roos that it's important that we recognize the clinical trials were done with 2 vaccines 4 weeks apart, and I'm talking about Moderna. To give one vaccine and then wait to see if we're going to get the second dose timely is not advisable, because we know that the clinical trials were done very specifically, and that 95% efficacy that we got was based on those 2 doses. And so the recommendation is that we stay with the 2-dose regimen, and that we do not, at this point, unless a vaccine becomes absolutely short around the country, we cannot get the supplies, then maybe a different model may need to be explored. But right now, the 2 doses 4 weeks apart is what we are recommending to be followed. The VaxForce Committee, again, as the mayor said, we are grateful for those individuals who are going to work with us through our phases. That document has been posted on the city's website, and you can take a look at that at your leisure. It talks about the phases. We are in the process of setting up our meeting next week. The mayor is the convener, will do the opening remarks, and will charge the committee and absolutely thank them for their work. We anticipate there will be 6 committees that work with the VAX Force. One will be healthcare, which will underscore medical and scientific facts. Again, I want to be clear, our job is to recommend. Our job is not to mandate. But in order to do that, we want to give you all of the facts that you need to make decisions, and that's what we will be doing. I've gotten phone calls from individuals who said, is this task force going to tell me? This task force is going to make recommendations, and we're going to make the recommendations based on medical and scientific facts. And so the healthcare subcommittee will be doing that work. Then there will be research, which we will be tracking the public's attitude in the city of Springfield around vaccination, distribution, including vaccine hesitancy and vaccine confidence. So those 2 areas is something we anticipate using a survey tool. Operations will develop best practices on operation and information and the distribution system. Education, we will identify the intersect of COVID-19 vaccine distribution and institutions of higher learning, secondary education, and youth-serving organizations. So we will have an education subcommittee. Faith, we will develop comprehensive COVID-19 vaccine resources for the faith community and houses of worship. And what we want to do is make sure that we are listening and hearing what those concerns might be throughout the house of worship and giving concrete information. And then finally, there will be a subgroup for diversity, equity, and inclusion. And this group will develop COVID-19 material resources for diverse groups in Springfield, including marketing materials and online engagement, while soliciting feedback from groups to improve communication. And so those are the 6 groups that I am anticipating that we will try to populate with members of the committee in order to get feedback from the general public in the city of Springfield. The goal is to make sure we're doing all that we can to give concrete information, again, to our residents with these amazing individuals who will be working with us, and we are, again, grateful to them. I'm going to go over quickly the data that's up on the board. You have heard much of it, but there are 910 additional cases in our city. And there were 886 the week prior and 957 the week prior to that. The case count, you can see 94 Sunday, last Sunday, 122 Monday, 86 Tuesday, 210 Wednesday, 224 Thursday, 32 Friday, 142 on Saturday. It is important that we understand the totals as far as age group are concerned. And I'm just going to go quickly to the wheel instead of going through each age, although you can see them there. And what I think we recognize is that all age groups in the city are impacted, but particularly we still continue to see that under 50 age group as being the primary group where we are getting positives. And so the 30 and under is 41%, the 31 to 50, 32%, 51 and older is 27%. The race category is broken down, again, that unknown category where we're seeing that 30% again becomes a concern, but if that data is not given to us, then we're unable to report it. So Black African American, 13%, Latinx, 22, white, 33, Asian, 2%. And so that is the race breakdown for the city of Springfield. We continue to report this data, and we will be updating on a weekly basis the work of the VAX force and the work that's being done. There are documents that are going to be sent to the committee and we will again have that conversation and start this very important work. The city of Springfield and our residents have sacrificed throughout this pandemic, and you continue to sacrifice, and we in public health are extremely grateful to you for all that you've done. I particularly want to once again recognize our healthcare heroes who are working in hospitals every day, the staff of the Springfield Department of Health and Human Services who continues to do their work. I want to thank Patrick Sullivan, because when I need to set up sites and do the work, the facilities department along with Superintendent Warwick are right there to help and jump in. Superintendent Warwick will talk about the testing that we will do for athletes, but I am deeply grateful of the patience, the understanding, and the commitment. Our test site will be Bowling School. We will walk that today hopefully with AMR. We are working to see if we can involve Springfield school nurses in our process, but it takes cooperation, it takes collaboration, it takes partnership to get anything done in a way that hopefully will be a successful outcome. And I'm grateful that in the city of Springfield, there are those who are working with us to make sure that our outcome is one that we as a city can be proud of. We want to make sure that everyone in our city is taking the necessary precautions and has the ability to move into 2021 healthy, whole, happy, and most importantly, together. Thank you.
Thank you, Commissioner Carlton-Harris, for you and your division's continued efforts. Appreciate it. Now, getting the school perspective, Superintendent Springfield Public Schools, Deanne Warwick, will come up and give you an update pertaining to our progress on remote learning and our continued retrofitting of our school buildings. Superintendent Warwick.
Thank you, Mayor. Good morning, everyone. Our meals program has continued to be an enormous success. This weekend, over the New Year's, we distributed on Wednesday for the entire weekend, and we distributed 92,104 meals. And since school closed down in March, we've distributed 5,262,926 meals. They had a major article in the DESE circular this week that Bill Ricca had delivered 1 million meals, and what a great accomplishment that was. And I was thinking that Springfield has done a great job with this. Our attendance, in looking at it through the first part of the school year through the end of December, the average daily attendance for students is 92.1%. And given the pandemic and the situation we've experienced, that's really a great rate of attendance. It's only about 2% under what our normal attendance. So that's rather incredible and a real compliment to our staff. Our school committee took a vote to reopen school for the general population at the beginning of the fourth quarter, which would be April 9th, giving us the opportunity, though, to bring in some specialized groups sooner, including some high-needs sped kids, but perhaps vocational, and our SLIFE kids, our kids in the ELL program that have significant interruptions in their learning. So we're exploring that, and we're going to be meeting with school committee regularly to formalize a plan on that. In the meantime, with the mayor's support, we put over $1 million into our school ventilation systems and are upgrading those ventilation systems so the schools will be ready for students. And Pat Sullivan has just done a tremendous job with that, and the mayor in supporting us with that. And we're anticipating that work will be done in March. Flu shots, just a reminder to the public to get those flu shots done. There was an extension. Originally, they were mandated to be done by the end of December. Now it's the end of February, but just a reminder to families, for anyone that's going to return to school, they're going to have those flu shots like we've treated immunizations in the past. With MCAS, there still hasn't been a final decision from DESE relative to MCAS this year. They put the MCAS tests off later, but we are going to have to do the 12th grade retakes in January unless DESE decides to cancel those. So we'll give you more information on how they're going to handle MCAS, as the year moves forward. With our health commissioner's support, we've done a tremendous amount of work relative to exploring our options with winter sports. And our plan is to try to get those sports going January 11th, so there is a little delay in that. And that would be basketball and swimming. Wrestling has been put back to the spring. But in order to participate, the students are going to have to have been tested prior to the year, and 3 tests during the year, beginning, middle, and end of the season, to really make sure that we're adhering to the safety protocols and it's as safe an experience as possible for our students. DESE just issued a student learning time report, and Springfield exceeded all the requirements. So with the new requirements for student learning time, our plan exceeded all those requirements. So we're in really good shape there. Our remote learning plan has been going very, very strong, and I'm very appreciative of the great work of our staff. Thank you, Mayor.
Thank you. We'll now go into the public safety component, and again, I want to thank fire and police. People been able to work remote. Many of my city employees have been out there on the street, whether it's DPW or parks, facilities, inspectional services with health or building, governmental services. But police and fire are called to many challenging and difficult and at times life-saving situations. And they're putting their lives on the line day in and day out. And I'm very appreciative of that in order to keep our city services going. With that, I'll bring up the Fire Commissioner of the City of Springfield, Bernard B.J. Calvi. And again, to he and his team, tremendous round-the-clock work, 24/7, on being able to solve that arson case pertaining to the Martin Luther King Jr. Presbyterian Church. Commissioner B.J. Calvi.
Thank you, Mayor. Good morning, everybody. Happy New Year to everybody out there. At the Springfield Fire Department, we currently have 5 people down with positive COVID tests. We have 11 additional people awaiting COVID testing who have had a close contact or close exposure to somebody who was positive. And we have 1 dispatcher awaiting testing for the same close exposure scenario. We're continuing to clean, we're continuing to keep everybody safe as best we can at the fire station with social distancing for what we can do while doing emergency work. That being said, I'd like to thank all the firefighters at the Springfield Fire Department for the hard work they're putting in. These are very stressful times for us with the way we operate. Everyone's doing a fantastic job, from the firefighters, the officers, the chiefs, all the way up through the command structure of the fire department. Everybody's doing top-notch work to keep everybody in the city safe. I want to thank them for all their hard work and wish all of them a happy new year. On the safety front, arrests have been made in the Martin Luther King Presbyterian Church fire. The 3 counts of attempted arson have been charged at this time. The investigation is still ongoing with the main church fire that happened on the 28th. Our partners with the Springfield Police Department, the FBI, and the Alcohol, Tobacco, Firearms, and Explosives have been working round the clock trying to gather evidence on this fire and make sure that the person's charged appropriately and stands trial for the appropriate charges. We'll have more on that as the week continues, hopefully. Other than that, the last thing I'm going to mention is Christmas trees are being taken out of people's homes. The DPW is making the rounds collecting them. Please do not try to burn your Christmas tree in your backyard. It is very dangerous. Let the DPW pick it up. And that's all I've got for this week. Again, thank you to everybody, and have a great week.
Thank you, Commissioner Calvi. Now for the update from the Springfield Police Department is the Police Commissioner for the City of Springfield, Cheryl Clapper.
Thank you, Mayor. Happy New Year, everyone, on behalf of the Springfield Police Department. As the Mayor said, I'm down 33 employees because of COVID. 24 are positive. 9 are out because they're awaiting testing. The concern is that of the 9 that are out, they are exhibiting some symptoms. So we are getting hit hard, just as hard now as we did when the virus started back in the spring. My concern is certainly with manpower to make sure that the city of Springfield can remain safe. What I'm asking for and what I'm getting cooperation with right now, and I thank Commissioner Helen Carlton and Pat Sullivan for their continued support on testing and cleaning. And I need testing desperately because I'm trying to keep the manpower up. I have a contact with state police and they are experiencing the same things we are. It's shortages in personnel because of COVID. So the testing is important to us, and we look forward to getting the vaccine into the department as soon as we possibly can. I also mentioned it was a busy weekend, a busy New Year's Eve. There's over 300 calls on the 4 to 12 shift, and more than that on the midnight to 8 shift. The gun battle on Nursery Street resulted in a state trooper being shot in the thigh. They ran into a gun battle in response to shots fired. The shot spotter activation system went off and did as it was supposed to, and the 2 brave officers did as they were supposed to do. They went right to the scene to try to protect lives. And in doing so, one of the gunmen turned and fired once at the state police car as it pulled up and twice at the Springfield police cruiser. I am grateful and thankful that the state trooper will be fine. And I am grateful and thankful that the Springfield police officer did as he was trained to do, and that was render first aid to that trooper, remain calm, and use restraint and not firing back into a very dangerous situation with so many people outside at the time. Through their diligence and help with canine officers, the subject was located and he was placed under arrest. As mentioned, Mr. Christopher Gardner, who has an extensive record and past firearms charges, is under arrest for this crime. We are looking for a second subject, and we have recovered the 2 guns that were used in the incident. Also, on Saturday night at 11 o'clock, a pedestrian was struck on Locust Street. It was a fatal hit and run, and I thank the Traffic Bureau officers and their diligence in locating the car and the vehicle's owner, and we will have more coming out with that in regards to charges. I thank everybody involved with this MLK Church fire. Their work in it has been extensive because this person, the perpetrator, has committed crimes all over the Northeast. So we needed help with our federal partners in piecing together a case that's strong enough to arrest him and hold him. We are finding more out about him all the time. So FBI, ATF, state police, and Springfield Police and Springfield Fire continue to work on that to build a sound case against him. I will also like to thank and credit my crime analysis unit. It is through their hard work, intelligence, and videos that we're able really to piece together a good case for the arson against the subject. So thank you, crime analysis. Their work is invaluable to us. The cameras throughout the city and the time and effort they put in is deeply appreciated. As always, I thank everybody in the Springfield Police Department, both sworn and civilian, for their continued hard work into the new year with the stresses on us between the police reform, the actions, the nervousness of the gun violence spiking, and COVID. These people show up to work day in and day out, and they know I'm their biggest fan, so thank you. Thank you, Mayor.
Thank you, Commissioner Clapper. And I think we have reported when we have incidents like this, unfortunately, that occur with houses of worship, the commissioner orders special attention and increased efforts to all houses of worship on it. But again, to Commissioner Calvi and Commissioner Clapprood, to our partners on the federal and state level, fantastic work, because getting updates. I know you're working at 24/7 to apprehend this individual, and again, I hope that he is put away for a long time. And the old adage, if it looks like a duck, it quacks like a duck, and it walks like a duck, it's a duck. So this was targeted, and we'll go from there. We'll go from there. We'll now receive an update pertaining to Department of Public Works and Director Chris Signoli. Again, I thank his team. I see them many a times, whether at DPW on the streets. They're out there day in and day out, whether plowing the streets, treating the streets, picking up the trash, picking up your yard waste, now your Christmas trees. They haven't stopped since the onslaught of this COVID-19. So with that, the Director of the Department of Public Works, Chris Signoli.
Mayor, thank you very much. The DPW currently has 2 employees out due to COVID. As the mayor mentioned, we will be picking up Christmas trees starting tomorrow. We will be going for 4 weeks, so everybody will have 2 shots. It goes out on the day of your recycling. Do not mix it with anything else. It will be picked up separately. It cannot be bagged, and all the ornaments have to be off of the tree. Yard waste, we're going to go for a few more days, try and make some runs around the city and pick some stuff up, but we are essentially complete at this point, but we will run it through this week given that there's no snow. A few weeks ago we mentioned that we received a wonderful donation from MassCon, so I'm working with Helen and other agencies around for distributing all that material. The city's also been notified of 2 projects that we received funding for. One of them is for Shared Streets program that we will be doing work on Lower Worthington Street, and this is to increase sidewalk area for outdoor dining. And we also received notice of funding for repair of a culvert in downstream area off of Tiffany Street, where we've had some major problems over the last few years. And that is it with regard to the DPW. Thank you, Mayor.
Also, congratulations to the expansion of the Signoli family. Director Signoli indicates he's a grandfather again, a beautiful baby boy named Bull. I don't believe that's Italian, though, Chris. No, it's not, but healthy and everything is good. Congratulations on that. Parks and Facilities, Director Pat Sullivan, who has been invaluable because he really helps out any and all the departments, and his team, who have also been on the street and in the buildings since the onslaught of COVID-19. I appreciate his efforts immensely. So the Director of Facilities and Parks, Patrick Sullivan.
Thank you, Mayor, for your support. We have 5 out due to COVID, and I just want to thank the employees of the Department of Parks and Buildings. When we've had employees out for any reason, fellow employees have canceled their vacations to cover that person being out sick, so we appreciate their support. We continue to install the I-Waves and carrier units across the city. And Helen, thank you for your kind words. We're very proud to be working with you and setting up Bowl and school and the vaccinations. I was on the phone with her and the superintendent over the weekend to work out the details for that site. And just a reminder to the public, if you are scheduled for appointments here at this building, at City Hall or Tapley Street, please reschedule your appointment if you're not feeling well. Bring a mask with you when you arrive, and then please know that a temperature check is mandatory prior to entering the building, so we appreciate your continued cooperation with these protocols. Thank you.
Thanks, Scott. As I always say, Springfield's in the business of doing business, and Chief Development Officer Tim Sheen and his team have done a great job to help not only triage businesses, but help stabilize them and very hopeful set them up as we rebound after we defeat this COVID-19. Tim, you look like you're coming direct from the slopes. Chief Development Officer Tim Sheehan. Come on in, John Claude Keeley.
Thank you, Mayor. The Development Services Division has got 5 employees out due to COVID. We are in the process, based on the President's approval of the relief bill. We are formulating a program that will be providing enhanced technical assistance, professional technical assistance to those small businesses and nonprofits that ultimately don't necessarily have the resources of a professional accountant or legal assistance in getting through those applications. We think this is critically important. A lot of the smaller businesses, unfortunately, didn't necessarily benefit from the first couple of rounds of PPP, and we think that this added professional assistance will assist greatly in reaching more businesses and fulfilling more of their needs. With that said, we are obviously going through the relief bill, looking at every opportunity that the city can take advantage of under that bill for additional resources. As the mayor indicated, there is still funding available for mortgage, utility, and rent assistance. If there are any individuals that are experiencing housing insecurity or any landlords that know of tenants that are in that situation, we encourage them to contact Wayfinders to start that process. It does take a little bit of time, but getting into the queue is always helpful. Thank you.
Thanks, Tim. Thank you, Director Sheehan. And the Executive Director of Wayfinders, Keith Ferry, indicates to me when you getting into that queue, it is so important that that application, all the information that is needed is provided and filled out. So that way it will not delay the award coming your way. You heard the updates, financial updates from Chief Administrative and Financial Officer TJ Plan, I said earlier, and from Human Resources and Labor Attorney Bill Mahoney in our Cabinet Heads meeting, and City Solicitor Ed Pakula, which were on status quo that we've been working at. So at this point in time, we'll take any questions or comments you might have of Cabinet Heads or myself, if there's any. Yeah, Glenn. Sure. Commissioner Colton here.
Commissioner, I'm curious if, I know we're still not completely have all the data that we're going to need or even all the information from the post-holiday period. I'm curious from your early results that are coming over the tested right between Christmas and New Year's, if there's any indication about how big this could potentially get based on your, whatever tracing you've been able to do on some of these cases. Do you have any indication where the direction is going in, or is it all still just wait and see?
It really is wait and see. We absolutely know what the data is from Thanksgiving. We do not know specifically what that data is from Christmas. We are seeing an uptick, as you see, but also New Year's will probably also give us more positive cases, unfortunately. So we don't have a specific percentage of increase that we're expecting.
And I know that part of this, the Mayor mentioned before that the stop the spread was site closed for a few days in both holidays, and you've seen a dramatic fall in the number of statewide tests that are being reported. Is there any indication that people who might not have any reason necessarily to test who might have done so either to try to travel or whatever reason? I mean, are you concerned about the lack of testing that seems to be coming out? It just seems to be people might be in the hospital. People who still have access to testing despite the holiday. Is that a concern for you at all?
There is a concern. Obviously, we'd like to have testing that's consistent and happening every day in multiple sites. But I can tell you that right now, AMR has done over 91,000 tests. 40,000 of those were Springfield residents, and I believe there are around 6,000 positives or so. And so we have, as I said, when you heard Dr. Kerouac talk about the number that Bay State has done since the beginning, and you think about what AMR has just done in really since September, they've done a phenomenal job of testing, and 40,000 of those tests were Springfield residents. But absolutely, more testing sites in multiple locations would be something that we certainly are looking into and supporting. And again, remember that AMR has done testing at Friends of the Homeless. They've done testing at the Jewish Community Center. So they've done some targeted testings, but we would love to see that more consistent. And the city is looking at using CARES dollars potentially to do testing expansion.
And of course, the flip side of that is the demand side of it as well. You know, I'm thinking part of the reason for fallout wasn't just access, but just people thinking, well, I don't need to get tested, I'm not going anywhere, I'm done. Do you imagine there's going to be some desire to, with no major holiday on the horizon, you know, probably as the weather starts getting better, there's going to need to still be some public information campaign to encourage people to still be tested, even if they're not necessarily like contact with somebody or at high risk? Is that something you're looking at?
AMR testing reporting prior to holidays was pretty consistent. So even prior to the holidays, individuals were seeking testing, and that's borne out by their numbers. Certainly those numbers potentially increase because of the holidays, but there has been no shortage of individuals showing up for testing as long as that testing site at Eastfield Mall particularly has been open.
Thank you.
Matt, we continue to push for more testing. AMR has been fantastic. I can't say enough about them. The key here is the Eastfield Mall site is almost turned into a regional site. So you get a lot of people who are not from the city of Springfield. So we've tried to hit this two ways. One, we want to increase parochially in Springfield, but you've seen those one day, twice a week in certain other cities or suburban areas that are just specific for those residents. We'd like to see a combination of that. Can do specific for those residents and continue expansion in Springfield. Everybody wants to come to Springfield, I realize that, but that at times will make for a long line. So we're pushing, and I believe there'll be some announcements coming up very shortly on expansion of testing. And I think the word is out there because more and more people I hear about that are going to get tested. On the same hand, twofold, the vaccine. You know, we want to get it ASAP. I know some allotments that have come from the federal government down to the states has not been the numbers that they were told they were going to receive. So that pace on the federal level needs to be picked up ASAP. And I think, you know, again, I indicated about fire and police, but also what Commissioner Helen Carlton-Harris brings up a good point. I've seen other areas in the nation where the lines are for miles and 6-8 hour waits, and you got to have the checks and balances on it of who should get it, you know, what are the prerequisites on it. So we're trying to get it done yesterday and, you know, following the guidelines of the first responders. It would have been nice if, you know, we can only move forward now, but months and months and months ago that National Defense Act should have been kicked in to be prepared for this movement and ready to go, but that's where we stand right now. Any other questions or comments? Okay, hearing none, to the viewing public, listening public, and to the print media, thank you for tuning in. The storm clouds are still there. Storm clouds are still there. But you know, after a storm, the sun comes back out. We're at that point in time where we need to stay vigilant. There has, you see in our numbers, there has been a consistent and tremendous increase in the numbers of positive COVID-19 testing. The vaccine, which is great news, is here, but it is insufficient at this current point in time. It needs to pick up the pace ASAP. So I'm going to continue to ask each and every one of you to stay vigilant and wear those masks. Try to avoid gatherings if you can. If you can't, the social distancing or physical distancing is extremely important. I know it might sound silly, but continue to keep washing your hands. If you don't feel good, stay home. Stay home. So we will continue to keep you updated. We will do everything in our power to make sure to keep the residents and our business community here in the city of Springfield safe and sound. I appreciate your continued patience. I know it's been aggravating, but your cooperation and collaboration is, again, continue to be desperately needed. We're starting to move forward, but we cannot let our guard down. And we'll get you more information about the reasoning why it's important to take that vaccine shot. Helen and I will continue to work hard with my other cabinet heads to expand testing more and more. We will continue to partner with our medical professionals, Dr. Kerouac and Dr. Roos, and AMR, Patrick Leonardo. So we're all working in concert together. But please don't let your guard down. We'll see what the numbers look like after this Christmas and New Year's Eve time frame. We're going to continue to push to pick up the pace on testing. We're going to continue to push to pick up the pace on vaccinations and work with our federal and state partners, and we will continue to fight for you tooth and nail. Happy and healthy New Year, to a prosperous 2021, and go out and have a great day. God bless. Thank you.